Is age a barrier to spine surgery? Should I get my surgery while I'm still younger?
Generally, age is not a factor in my surgical decision making. Yes, obviously, people who are very old or have multiple medical problems, that's something we're going to be more careful about. But anesthesia is generally very safe. If you're an older person and we're considering surgery, we're going to get clearances from the heart doctor and the medical doctor and make sure that you're safe to have anesthesia. Sometimes we need to get a clearance from a pulmonary doctor. But generally, anesthesia is safe, and I'll consider patients surgical candidates in their 70s, 80s, and sometimes even 90s for spine disease because if they're the right candidate and they have a complaint that fits with their MRI scan, they're most likely going to get better. And it's like you said, it's one of those things where age produces degenerative arthritis and can cause pinched nerves. And so, do we sentence that person to the rest of their life being in pain because they're older? No, they're a potential candidate for surgery. I've often heard other people say, well, I want to get my surgery done while I'm young because I don't want to have it later when I'm older. And I say, no, you have surgery when it's time to have surgery, not before, not after. You're not thinking about the future to have surgery. You have surgery when you need to have surgery. And the indications for surgery are intractable pain, having more bad days than good days, having a scan that shows a lesion that we can fix, that's focal. In other words, it's a single lesion. It's not a multi-level problem. The chances for multi-level surgery, the success rate does not continue to go up. It's better when there's a focal lesion. And when you've tried all conservative treatments, those are good indications for surgery. And yes, we're going to consider your age. Yes, we're going to consider your medical conditions. But people can undergo surgery in their 80s and 90s and still do very well in selected, appropriately chosen surgeries.